obstetrician and gynecologist. I'm the president of the Lebanese Medical Association for Sexual Health, based in Lebanon, and we work on advocating for healthcare of lesbian, gay, bisexual, and transgender individuals in Lebanon and the Arab world. I'm very pleased to see the Saudi Arabia ED, Shukran, thank you for being here, and of course the ED of the other, of Kuwait, Lebanon, and Egypt, and other countries. I want to start by responding to talking about marriage. We are not asking for marriage. We're not even asking for rights back home. All we're asking for is to be able to live and live in dignity and have access, just the simple access to healthcare, to education, to services. We are marginalized, we are in fear, and we are hiding. I want to thank you all for taking the time to come here and listen to all of us coming from all around the world to hear our stories. And we're not here to advocate for human rights. I just want you to listen to what stories we have from back home. Did you know that in Lebanon, any person suspected of being gay can be dragged to a police station, exposed to an anal test to assess if they are homosexual, even though those tests have no medical ground. A woman can be exposed to a virginity test in a police station to check for her honor. LGBT, recently, more than 1 million Syrian refugees came to Lebanon. It exceeded 1 million. Many of those are LGBT, and I had the chance to meet many of them in Lebanon. As a physician, I am alarmed by the great potential for communicable diseases, sexually transmissible infection, and especially HIV, especially with the lack of resources and lack of health services and care that is catered to attend to the needs of LGBT Syrian refugees. And this is not an issue only for Syria and Lebanon. I mean, deporting HIV positive people from any other Arab country is not going to solve the HIV problem over there. There's a lot of disparities in healthcare, and disparities are not going to help advance the agenda of the World Bank in deleting poverty, in ending poverty. The homophobia is the norm in my country and in my region. I recently designed a study that I carried in the States, in Canada, but also importantly in Lebanon, that showed up to 73% of physicians in Lebanon believe homosexuality is a disease. And 50% only, and up to 50% would not take care of a gay patient. And mind you, this is in Lebanon, which is assumed to be the gay haven of the Middle East. You can only expect what it is like in other Arab countries. And in Lebanon, we have a media that talk about those issues, so we hear about what's happening. If we don't hear about it in other countries, it doesn't mean it's not happening. The World Bank has just funded a project in Lebanon. The project's title is Social Promotion and Protection Project in 2013. I reviewed the project. There is no mention whatsoever of any attention to groups marginalized based on gender, sexual orientation, or gender identity. So I have no clue how this will advance the agenda of the World Bank to eliminate poverty if when you help one group to be pulled out of poverty, you put another group down in poverty. You impoverish them more. And we understand that poverty is not lack of income or a job, and discrimination leads to poverty, health disparities lead to poverty and hinder prosperity. So thank you all for being here and for giving this issue your attention, because I think we do need safeguards that would help us eliminate any kind of discrimination based on gender, gender identity, or sexual orientation in order to be able to achieve the goal of the World Bank to eliminate poverty.